Good evening, everyone, and welcome back to Goffstown Today, a local public affairs series that's being brought to you by the Goffstown Democratic Committee. Our goal with these programs is to provide meaningful discussions of local and state issues important to the greater Goffstown community. We're now into our second season of providing this programming as a community service. This is show number 32 in the series. Our special guest today is New Hampshire State Senator Tom Sherman of Rye, who represents District 24, which covers Rye, Greenland, Hampton, Seabrook, and multiple other towns along the state seacoast. Dr. Sherman, gastroenterologist who's in his second term in the Senate, after also serving 2 terms in the House, is the only medical doctor in the Senate and one of only 5 MDs among New Hampshire's 424 state legislators. He's a member of the Senate Health and Human Services Committee and the Transportation Committee. Healthcare is one of his areas of special interest, and he has sponsored or co-sponsored measures on issues such as Medicare, Medicaid, and reducing prescription drug prices. Welcome to Goffstown Today, Dr. Sherman. Let's start with a shot at the elephant in the room. The U.S. Supreme Court's recent decision allowing the Texas 6-week abortion ban to stand. What do you feel that bodes for New Hampshire, which enacted its first ever abortion ban this session through use of a rather sneaky backdoor budgetary maneuver? Will the extreme elements in Concord be pushing for even more harsher action in January?
Well, thank you, Len, and thank you for having me, and thank you to Goffstown TV for sponsoring this kind of show. I think it's really important that the voters understand on both sides, actually on all sides, what the issues are, and so that their vote can be as informed as possible. You are absolutely correct. First of all, that in the budget, the Republican Senate and House came to an agreement to allow the first ever abortion ban in the state of New Hampshire. It is harsh, and I will be very brief, but I'll tell you exactly how harsh it is. And I have been quoted, and I still believe it's cruel. We are a state that has always strongly valued individual freedom, especially to make your own healthcare choices. And one of those freedoms has been in reproductive rights on the side of women. And so when New Hampshire goes down this slippery slope of putting in abortion bans, the next step may well be what's happening in Texas and other states around the country. What makes this so unique is, first of all, that the ban itself was unnecessary. There are no documented abortions after 24 weeks in the state of New Hampshire. What does happen at a place like Dartmouth, for example, where they have among the top 2 neonatal intensive care and maternal fetal medicine programs in the country, is it completely undermines the work that they do in late pregnancy to make sure the fetus is safe and that the mother is safe. Not only does it ban any intervention, which is actually called therapeutic termination, it makes it very difficult to do that therapeutic termination, even for the welfare of the mother. It does not allow exceptions for rape or incest. It doesn't allow trying to even save the life of the fetus, which is really sort of weird, because there is a case where you have to terminate one pregnancy to allow the other fetus to survive, and that will become illegal. Speaking of illegal, it criminalizes abortion, which is fairly unusual in the United States, not unheard of, but certainly in New England, It's pretty unusual to put a criminal penalty on this, making it a felony for doctors who do that therapeutic termination to perform what is the standard of practice for a mother whose life is in jeopardy or whose health is at risk, or to save the life of a pregnancy where there's multiple fetuses. The other thing that it does, which is really among the most cruel parts of this, is that it requires an ultrasound. There's an expense, $600 to $1,500, depending on where you have it done. It's completely medically unnecessary early in pregnancy, which is where the vast majority of abortions take place. But imagine if your loved one is a woman who is a victim of rape and she needs to have an abortion. She wants to terminate the pregnancy. It's 14 weeks or less. She's going to have a vaginal probe inserted to determine the gestation of that pregnancy, of that fetus, even though there's no medical necessity attached to it, at a huge cost. And that itself is a violation of her bodily integrity right after she's been raped or been the victim of sexual assault. That's cruel. And it's the state of New Hampshire, it's this legislature, it's the Republican majority that has said, yes, we're going to do that. And on the floor of the Senate, I held up an ultrasound probe and I showed it to the men in the room who were the Republican men who didn't understand what they were voting for, and they still voted for it. So they voted for this knowing that they were requiring a medically unnecessary invasive procedure. It's cruel. It is the first step for New Hampshire to move towards Texas. And the green light from the Supreme Court is just going to encourage that slippery slope. And I think we need to be sure we are aware what this legislature is doing.
I wonder sometimes if our legislature is aware of what they're doing. Let me ask, trying to put it in more understandable terms. So if you had a situation, one that you mentioned, say a conjoined pregnancy where it seemed to be medically necessary to terminate the life of one fetus that wasn't thriving and be able to save the other one, that would be barred by this.
Correct. Actually, there would be two situations. One, you mentioned conjoined twins or conjoined fetuses. In some cases, either the fetus itself has what's called a fatal fetal anomaly, or because of the way they are conjoined, there is no opportunity for survival outside of the womb. Both of those would be forced to be carried to term under this current law that the governor signed. Governor Sununu signed this. The Republican legislature passed this. So fetal fatal anomaly would have to be carried to term, even though the mother knew that fetus was not going to survive. And then in the case of some twin pregnancies, there's basically a twin steal syndrome where one of the fetuses is feeding off of the other one, and both will die if you don't terminate one. It's rare, but it's a possibility. And intervening in that case would be a felony in the state, is a felony now in the state of New Hampshire.
It just seems barbaric to me, frankly, the situations that you mentioned, forcing a woman to carry a pregnancy to term.
Remember what's barbaric about this, what's cruel about it is it's not necessary in the first place. You know, New Hampshire is a place where we try to do things that are practical, common sense, and intervene to solve problems. This is solving nothing. It's actually creating problems. And the last problem it will create is when you start criminalizing the appropriate practice of medicine, you drive doctors, you drive providers out of the state. There is no way someone's going to want to practice OBGYN or this very high level maternal fetal medicine in the state of New Hampshire if they are likely going to end up in jail by doing the right thing. they're going to go to another state. These are not people who you can just pick off the street and they're a dime a dozen. These are people who are highly specialized with subspecialty training. So it's not something that's easy. As a doctor, I know that I wouldn't want to practice under the threat of felony or jail time.
So this could affect things, say, for instance, if you have a top program like at Dartmouth, attracting top talent to a program like that, if they're going to have to be practicing in handcuffs, so to speak.
Right. And, you know, in North County, we've already lost, or in the North Country, we've already lost many of our delivery, you know, our OBGYN programs. We've lost the ability to deliver children because we don't have the manpower to do it. So people have to travel a long distance. And if you can imagine this entire industry or practice, not industry, but specialty being under threat, and that specialty is the practice of OBGYN, that is one of the probably unintended but true consequences of this law.
And as far as any possibility of reforming, amending, doing anything to change it, probably there's not much hope until we get a new legislature in Concord.
Well, I think, you know, many of the state reps have been very clear that they are committed to this law as it stands. I can't imagine they're going to allow its repeal or any repeal of any part. That doesn't mean we shouldn't try, and I can guarantee you we will try to fix this. The best way to fix it is to repeal the whole thing, but certainly in order to preserve the availability of highly specialized practitioners, we need to get rid of the criminal penalties. We need to expand the reasons why we allow therapeutic terminations in the third trimester. And we absolutely need to get rid of the ultrasound requirement, which is not medically necessary. It's basically the legislature practicing medicine for which they have no training and for which there's no indication.
And once again, I wish I could say that I was surprised, but many things about our legislature disappoint me.
Well, in the words of one of the Republican legislators, you get what you vote for. And elections have consequences. And the people of New Hampshire on both sides need to recognize the consequences of this election. And, you know, there are many beyond this one bill, this one law, that I think really take New Hampshire down a completely new and troublesome road.
Certainly not the one I've known for the 30-some years that I have lived here. Let me move to another subject in which I know that you were involved. There was $6.3 million in federal funding for a substance abuse treatment and prevention that was tabled by the Joint Fiscal Committee in August after several Republican members basically demanded proof that it was effective and they weren't pouring their money down a hole. Is there any evidence that's going to satisfy them, or do you think that this is just a tactic on the Republicans' part to try and spike the funding and not take what's available from the feds?
Well, first of all, I think it is a mistake on the part of the fiscal committee that will result in loss of life in New Hampshire. It will make our appropriate response to substance use disorder and treatment of addiction, it will diminish it. And when we diminish the response, we absolutely know that people get sick and people die. Imagine if we did this, if the fiscal committee demanded to know what is the evidence in the state of New Hampshire that cardiac catheterization is effective in treating chest pain. Imagine if the legislature turned to me as a gastroenterologist and said, well, listen, Dr. Sherman, you know, I want to know that your application of cautery to a bleeding ulcer works, and I want to know at what rate before I allow you to actually do that and before I reimburse you for those services. Practice of medicine is something that is set with studies that are done nationally or internationally. And then how we practice medicine is called standard of practice. Our substance use, the people who are treating substance use disorder in the state practice standard of practice medicine. It's evidence-based. It has been shown to be effective. But if they're demanding that a small clinic show that they have efficacy in the treatment of a small number of patients, we don't know. Statistically, that's a useless exercise. But what we should be demanding is that our clinics and our substance use disorder treatment facilities are practicing evidence-based standard practice, and they are. And we also know that if you don't fund something, you don't have an effective program. One of the reasons in 2016, when I was on the task force that was set up by the then Republican House and Senate, one of the things that we worked on across the aisle was to make sure that our response to addiction was robust. What we found, though, was that New Hampshire had the second highest rate of overdose death and the second lowest rate of funding in the entire country to treat that. We're going back to that. The people on the fiscal committee are making a grave error that will result in loss of life, and they should be held responsible for that.
We can hope that the voters will, but what happens to the programs that are in existence? Will they at least be maintaining level funding? Will they be suffering funding cutbacks as a result of this loss or foregoing of the federal dollars?
Well, we've already seen, due to problems during COVID, we've already seen some of the programs have to pull back services. One of the real areas of weakness in our Department of Health and Human Services, and it's not the fault of anybody who's working there, is contracting. And so when we had COVID and we had to put out a whole bunch of contracts to a whole bunch of vendors, that overstretched the capacity, and the less high priority issues like substance use or mental health treatment took a back seat to COVID. Senator Whitley's bill helped build out that those contracting services. And we did that with bipartisan support with the commissioner. But the problem is, if you take away the federal funding, there really is virtually no funding for these programs. The state can't afford to do this on its own. So giving away federal funding or not accepting federal funding because you're demanding evidence-based success in these small clinics is just very misguided. And again, it will result in people being hurt.
Sadly so. Let me move into yet another area, which I am sure you probably have seen. This new round of advertising by the big pharma companies that's being aired incessantly on local TV that somehow turns Medicare negotiating for the best prices on drugs into something like big government is coming to take away your drugs instead of your guns this time, I guess. But it just strikes me that this looks like the latest kind of the big lie that turned those end-of-life consultations that were promised under Obamacare into death panels. What does the medical community feel about this kind of tactic that's going on? And I'm sure it's going to be with us from now through 2022.
Yeah, unfortunately, I believe Big Pharma has lost its connection to the people it is really meant to serve, which are the patients, not its stockholders. You know, I was prime sponsor of a bill that created the Prescription Drug Affordability Board, or PDAB, And we're getting underway, and our focus is on decreasing cost of prescription drugs, especially when it involves state financing. One of the things that we've all known, and all of my patients have known this for years, is that it's much easier to just order your medicines from Canada, and you get them much cheaper than you can in the United States. So part of the prescription package that we put in the last biennium when we were in control as Democrats was a package to decrease the cost, allow importation from Canada, and what the Medicare portion of this is actually to remove some of the restrictions on Medicare to start doing some competitive pricing on prescriptions. You know, it strikes me as really strange that pharma would be using this idea that we need to have a monopoly to keep being able to provide pharmaceuticals or the needed drugs for people, when we know that medicines like insulin and epinephrine and other critical medications, they've been driving those prices up and making them unreachable for people who absolutely need them. So first of all, yes, it is not true. Second of all, the proposal that is being put forward is one that will actually drop prescription drug costs. It might drop a little bit of pharma profit too. And that's the crisis that they would be facing, is a little less profit. But for the patients who are their primary customers that they seem to have forgotten, those patients are the ones who really will benefit from the programs that they're fighting against now.
Well, if I'm correct, hasn't the VA been negotiating for drug prices for a number of years? And if it works for the VA, why is it bad for one part of the federal government and not another?
Well, you're exactly right. And, you know, this is something that all we're asking them to do is to allow for some price negotiation and competitive pricing. That's the American way, right? Put a little free market into Medicare, and they're pushing back. So the answer is, first of all, it is not going to put anybody's access to needed medications at risk. In fact, it may make them much more affordable.
Well, let us hope so. Let me ask you how you feel, and I know that you've spoken on this in the past and it's about Governor Chris Sununu's handling of COVID-related issues. Things that he's done, like allowing the mask mandates to expire and signing that bill that basically said you cannot mandate COVID vaccination. I don't understand. His positions seem inconsistent to me. And, you know, I'm just, again, wondering what you think could be done about that.
Well, the positions are inconsistent. He is saying on the one hand, in fact, he's gone around the state spending $154 per unvaccinated patient, which came out to about $800,000+ of taxpayer money to tout vaccines. But at the same time, he's undermined our ability to vaccinate, not only for now, but also for the future. Make no mistake about it, the current leadership in the Republican legislature is hell-bent on dismantling our public health system that has made us one of the most successful states in battling COVID up until we lifted the state of emergency. I actually agree with the timing of his lifting the state of emergency. I had no problem with when he lifted the mask mandate, except I wish he had waited another 6 weeks, because I thought it was about 6 weeks too premature. At this point, the message is just chaotic. The message is, on the one hand, everybody should get vaccinated. On the other hand, we shouldn't provide a mask mandate in schools. We shouldn't allow mask mandates. And what we're really seeing is we're seeing politics driving healthcare policy and public health policy. And that's a huge mistake. Right now, we should be very consistent in our message that there are really only three ways to fight COVID. One is the things that we've known: hand washing and distancing. Two is masking, especially when we're indoors. And three is everybody go get the vaccine who is eligible, not only for yourself, but to protect those around you. It's safe, and COVID is not. If people say, well, the numbers of people dying from COVID are small, the numbers of people getting sick, missing work, closing down shops, closing down workplaces because they're sick, because they're spreading it to their coworkers, the cost to the economy, the cost in human lives, and the cost in just our public health is enormous. And in fact, the Kaiser Family Foundation showed that for every unvaccinated patient, the cost is over $20,000 more than if they were vaccinated, of taxpayer dollars.
Well, I don't think, unfortunately, from what we see every day in the news, that the public benefit argument, which you make very convincingly, is going to work on some of the hardcore dyed in the wool types. Would that it would, but let's end. We got about 3 or 4 minutes left. Let's end on something a little bit more positive, because I think that we both have to say that there's a lot of depressing news involved here. What do you feel was positive? Did any positive healthcare gains come out of the legislative session? Were there any of those areas that were of particular importance to you?
Yeah, well, yes. One of the most critical long-term and expansive gains was the passage and signature of SB74, which had to do with end-of-life issues and advance directives. We assembled, and my hat goes off to the Hospital Association and to Kate Hanna for doing an amazing job of bringing together a group of people who are experts in the area of advanced directives. That is such an important part of public health, healthcare, end of life. And it was done with, we had the diocese there. It had all stakeholders at the table. And we've basically rewritten, upgraded, updated, and clarified how those decisions are made. And that's critical. The other one, very quickly, that we're working on that is not completely legislative, is making sure that we take care of the kids with mental health issues. We had 51 children sitting in our ERs in February. We have a Supreme Court telling the state of New Hampshire, the governor, and the Republican legislature that they have to fix this problem. We know how to do it. And finally, they put some money in the budget, and we're getting a lot of movement now forward to address the problem of pediatric mental health crisis.
What are your priorities for the next half of this legislative session? Do you have any bills that you're planning to file, or any priorities that you'll be pushing?
Well, the three areas where I have traditionally worked super hard are on mental health, substance use disorder, and clean water, clean drinking water. We've made progress on all three of those up until the fiscal committee took away our federal funding. Other areas where I'm very interested is how we're going to handle coastal resilience and resilience across our state when it comes to climate change, which is real, it's here. We've seen that in the past little bit. And we've seen that in the flooding out in Keene and other parts of the state. We have to be working on that. Another area of really big interest is working with our federal delegation, who have done a magnificent job of bringing funding to the state on infrastructure projects that are long overdue for our roads, highways, septic, sewage, and drinking water. So all of those are very exciting moves forward. And really thanks to Senator Hassan, Senator Shaheen, Chris Pappas, and Congresswoman Custer. So my hat goes off to them for really advocating for the state to make sure we got the funding we needed to make these projects possible.
Well, let us hope that New Hampshire can move forward on some issues in 2022. Thank you very much for being with us today, Senator. We really appreciate your participation. And if you'd like to come back for another visit, I think that we might have a few other issues we can discuss. The 25 minutes went very, very fast for us.
I'm always happy to come back, always happy to meet with any town delegations, people who have questions, or just if somebody wants to call me and chat about some of this further.
All right, thank you very much, sir.
Thank you for having me. I really appreciate it.
All right, thank you. To you folks out there, thank you very much for being here tonight. You can watch these programs in a number of ways. They're aired here on GTV. You can also find them on YouTube if you search for the Goffstown Democrats channel. The videos are posted each week on the committee's webpage, which is goffstowndems.com. Some of those videos are also posted to our Facebook page, which is facebook.com/GoffstownDems. Please like them. Please share them widely with your friends and the community. Thank you for being here. Good night.